biggest business opportunity, one of the biggest right now going on?
So the biggest opportunity in the US is because of the connectivity between EHRs. We are able to access huge amount of data. So that's one. Second is because of the Internet of Things and other sensors, we are able to monitor a lot of individual data. So I think these are the two main things which wasn't available earlier.
Okay, that's great. That's great. My next question is obviously, what are some specific challenges in developing AI in healthcare? If you
So
want, I can repeat it.
yes, well, of course, Sanjit and Arun, you can add to my points,
Yeah,
but I think yeah, one of the main challenges is how unstructured the data is. So the electronic health records are not designed for clinical decision making. Most of them are advanced billing systems. So the data is not very granular. That is a challenge. So that's number one. Number two is the final diagnosis. A lot of times, the final diagnosis might not be accurate, or there is no way of verifying the final diagnosis. So you don't have that feedback loop in place. So these are some challenges.
Yeah, there are some other challenges like the privacy. It's for us like startups or companies. It's very difficult to get patient data for analysis, like for machine learning. And there is regulation, which is HIPAA in the US, CE marking and GDPR in the Europe, HDPSA in India, and all these things. Due to all these regulations, it's very hard to get good data for analysis. Another problem is transparency, but which we have actually tackled to some extent, which is a purely machine learning based algorithm cannot be transparent, like cannot give a proper reasoning why it is taking that decision. Like reasoning, like for instance, 90,000 patients having these kind of symptoms had this particular disease is not a logical explanation to a doctor. It doesn't help him decide whether he can accept that analysis or not. But in our case, we are able to give the doctor proper references to medical journals or medical textbooks. So it's possible because ours is more of an expert system, which is actually improving on its own using machine learning, not the other way around. And there's another problem with challenge in implementing is the socio-cultural problems. That is, the doctors are reluctant to accept using an AI assistant. It's they think that it will replace them, but in fact, it is actually empowering them. They are getting more time to do the work they can do better. Yeah, I think these are some of the most important challenges.
Hi, Arun, would you like to add something?
Yeah, I think Sunjit has more or less summarized what I would have said otherwise. A few more points is that, if you've worked on typical machine learning problems, one thing you will observe is that 80% of the time and effort is going in preparing a clean data set, which assumes that there is some kind of uniformity in the way data is generated and formatted. And as Vipin said, that's a huge challenge in terms of different, the data format and then access to the data. Like different doctors might have different diagnoses for potentially similar kind of symptoms, which could be because of the localized conditions there. And also the way the electronic records, medical records are formatted, and that could also be a potential challenge.
That's how blockchain and AI will work into future, because as a company we are asking this question everyone, whoever come on the panels, that what are your thoughts about making the two technology join hands?
We have actually thought about it, and we actually even started working on it. So that is, patient health record. That is currently this is in hospitals, certain specific hospitals they are doing going, and it is interoperability is still an issue. Although HL7 and all these standards are coming up, and interoperability is becoming a reality, but still the patient's health record is right now owned and saved in hospitals. What we are thinking of is a democratization of patient health record data owned by the patient himself or herself. So that would be possible with blockchain. That's a technology that we can make use of in that area. So if we can store these patient medical records in blockchain, it's not centralized. It's everywhere. And if the patient has that private key, only they can access, and they can give access to anybody they want to. So if they go to any other hospital, they can give their data, give their entire history, medical history from whatever hospitals or labs they have been to ever. So that's a promising application of blockchain in healthcare that